Good morning to all of you. Welcome to the Central Medical Stores in Kotu. I am Musa S. Jallo, Program Officer at the Health Communication Unit under the Directorate of Health Promotion. So today we are gathered here to receive a contribution in our fight towards the end of COVID-19. And this contribution is brought in by the Indian community in the Gambia. So first of all, I'll introduce them. We have here the senior logisticians at the expanded program on immunization. That's Mr. Lamin Sise. And then you have Pratt, who is a communication consultant with UNICEF. And you have Aja Kande, who is also a communication officer at the expanded program on immunization. And you have Mamanding, who also works in that same communication unit. And then you have the president of the Indian Association in the Gambia. And then you have the honorary council of the Indian community in the Gambia. And then you have my brother there, who is also association in the Gambia. And then you have Kemo, who is standing last, who is also working with EPI, the expanded program on immunization. This is happening today because we felt it was necessary to reach out to the Indian community to see how much they can support us in the fight against COVID-19. We've discussed a lot of things, and this is one among the a lot of things that we've discussed, which they have fulfilled, and then we are expecting some other things. But today, they supported us on the visibility aspect. That is, they printed some T-shirts. You can see the T-shirts here. Bro, you can hold it. 500 T-shirts, which they donated to the Ministry of Health from the Indian Social and Cultural Association in the Gambia. So to receive these donations on behalf of the ministry, we have the senior logistician here, Mr. Lamin Sise, who is going to throw some few lights on this before we finally give it to the Indian community to also say a few words. Mr. Lamin Sise, you're welcome.
To associate ourselves to this kind gesture from the Indian community. I think it has not been an easy journey. I think thanks to the Communication Task Force, they were very innovative. They came up with this. And one of the things was to have an engagement with stakeholders. And this definitely calls for public-private partnership. When you talk about COVID-19, it's multifaceted. So we definitely have to take a lot of dimension for us to fight COVID-19. So the vaccination part is very key, and this is where we are. And then as a country, I think we've gone very far. But along the line, we also need some aspects in the implementation, which is very key. And among them is community engagement and how do you convince people to definitely take up it. So it's definitely very timely that we said a big thank you to the Indian community. And of course, people behind the scene, the Health Promotion and EPI Communication Task Force and others who made this possible. I think they've done a presentation, and I think we understand that there has been a lot of commitment. And one of the things that is very assuring is that we've seen a positive move. They've started giving out T-shirts. And we hope this will not be the end of the show. And what we will tell them is we are very, very much delighted to be associated with them because once they were called to come up, they started to bring up something. And for the fight against COVID-19, it's very, very clear that government cannot do it alone. Currently, we are on a campaign supported by UNICEF, WHO, and some other partners. Of course, with the personnel from MOH and the community also supported. But I think these T-shirts will definitely go a long way in telling people what are we up to, what is the role of the vaccine, where do we definitely move from here. So without wasting your time, on behalf of your heads, we say very big thank you. We said this is not a small gift. We appreciated it from the bottom of our hearts on behalf of the program manager, on behalf of everybody. We are saying very big thank you to you once again, and we hope the partnership will definitely continue.
Yeah, thank you all. For giving us the opportunity to be here this morning. Mr. Lamin representing the program manager, the members of the EPI team, Mr. Oja representing UNICEF, our honorary consul here, and my colleague, Mr. Tarun, who is a very active and dynamic member of our community. I'm very thankful to him for organizing this on such a short notice. This is a small gesture from our community, on behalf of the Indian Social and Cultural Association. And as Mr. Lamin, as Mr. Jallo stated, we had in the past, whilst the pandemic was on, had distributed 2,000 parcels of food items to 2,000 families during the crisis. Having said that, our Indian government also contributed by sending by air 7 tons of medicines and other other items, which was actually handed over by Honorary Consul General to the Ministry of Health. Having said that, this is just a small gesture, and our intention is to contribute more towards the very important health sector, which we all benefit from. And I wish and hope and pray that more and more people will come forward and take the opportunity of taking the vaccine. Thank you very much.
Thank you very much.
Each time whenever called upon to do so. Very rightly so, the Indian collaboration with the Gambia has been always been a high, and it's growing. It's growing every year. Really happy to announce just a few days ago we celebrated something called ITEC Day, which provides scholarships. ITEC is the short-term scholarships given by the Indian government in capacity building to the Gambia. Very happy to say that Gambia is the largest user in the whole of the African continent of the ITEC program. We have about 60 scholarships every year for these short-term programs, and all are utilized. All the courses are, in fact, there's a large demand for these courses. So that it just shows that how we are growing in our collaboration. So I would really, yes, I would also like to say that India is probably the largest manufacturer of vaccines in the world. And the fact that we are able to use some of the vaccines from India as well in these programs makes us very proud. The Indian community is a diverse community. We have a long reach, so communicating through us, we could spread the word along with UNICEF and the EPI team. We could help you spread the word, the word about vaccines and the programs. Help you conduct camps in various places, in various of our centers as well. So I believe the Indian community and the Ministry of Health are working close in hand, and this can only be for the betterment of everyone who lives in the Gambia. Thank you very much. Thank you to the media as well for covering this event. Getting the message across is very important. Thank you.
Thank you very much, Honorary Consul. I think now the T-shirts are here. They will be presented to the senior logistician at the expanded program on immunization. It will be just a start of a new form of a relationship where we can partner to advance health in this country. Thank you all.
Thank you.